Good afternoon. My name is Quispe. I'm about to present the poster titled Regional Clustering and Wave Patterns Due to COVID-19 by the Index Values and the Lambda, Gamma, and Delta Omicron SARS-CoV-2 variants. The purpose of this study was to assess the all-cause mortality per epidemiological week as the outcome of interest, since it has been reported consistently as the most reliable tracer of the impact of the COVID-19 pandemic in low-middle countries such as Peru. We analyzed the weekly mortality rate to characterize each of the three COVID waves that affected Peru at the regional level and assessed their patterns and regional clustering. We obtained the death counts from the National Informatics System of Deaths and Population, estimate from the National Registry of Identification and Civil Status. Additionally, we used polynomial regression models to compare them graphically and performing a cluster analysis to identify regional patterns. As we can see in the figure 1a, this is the three waves that affected Peru since 2020 up to 2021. Here you can notice that the second wave is the highest one, and the third wave, in terms of mortality, was by far the slowest one compared to the cases count, which was 5 times higher as the peak of the second wave in the third wave. When we characterize the mortality rates using the polynomial regression, we can actually have a mathematical approach to the point of start of each of these waves. You can see here that the first wave started around the epidemiological week 21, go up and you have two peaks, and then we can get a slow descendant up to the lower peak, which we estimate around the epidemiological week 49 of 2020. Since then, it began the second wave, we have a peak around the epidemiological week 14, 2021, and they get down. Here we have a nadir that go for a long time, but if you can notice, there is a point where it actually started to, you estimate it started the third wave, priorly the Omicron introduction in the country, which is the point with Delta, the SARS-CoV-2 variant became half of the predominant variants in the country. Since then, it went slowly increasing up to the point of the entry of Omicron, which started the peak of the third wave and then started to low. Here you can see the distribution of variants of SARS-CoV-2 in Peru, and you can notice that since the introduction of the Wuhan variant and the emergence of new variants, Delta was the Gamma and Alpha were the second, the SARS-CoV-2 variant that predominated in the second wave. At the end of the second wave, Delta began to be introduced and started the third wave at the point where it became 50% prevalent in the country. At the end of in December 2021, Omicron was introduced in the country, which sparked the third wave up to the point to get into the peak. You can notice that in the heat map, there was a large variability in terms of the mortality across the 25 regions of Peru. And you can notice that the peak of each wave was different in time and different in magnitude. And in terms of mortality, the largest mortality was recorded in the region of Moquegua in the third wave. And even though there we identified in our cluster analysis 6 patterns in the first wave, 2 patterns in the second wave, and 2 patterns in the third wave. As you can notice in the map, the epicenter of the COVID pandemic in Peru started in Lima and go north to Huancayo and south to Ica. And this is because Peru is united by the Pan-American Highway along the coast of Peru. And you can notice also that Tumbes was also a second point of entry of COVID in the country because this is the limit border with Ecuador. In the second wave, you can actually notice how the pattern from having Lima as the epicenter is clearer, because here you will notice that Lima, Libertad, Ancash, Ica, and Arequipa, together with Junín, share the same pattern of a wave that we could characterize later. The rest of the country was characterized as the second pattern. In the third wave, with the introduction of Omicron, the spread of COVID-19 was explosive in the country, affecting in parallel most of the regions of the country, with later third wave in Loreto, Amazonas, Pasco, and Cajamarca. As you can see in our dendrogram, in our analysis of cluster, we identify 6 patterns in the first wave, 2 patterns in the second wave, and 2 patterns in the third wave. In the first wave, you can actually notice how we can split and characterize the wave as earlier and higher, and some early but lower intensity, some middle wave with high intensity, some middle wave with low intensity, some late waves with low intensity, and Moquegua, which is standalone as the region with the highest mortality in the country during the first wave. In a second wave, you actually can split the country in 2 different patterns. The first pattern of high waves with different peaks in times, and the second pattern which was lower in intensity. In the third wave, you can actually split the country also in 2 patterns, but the first pattern was an explosive increment of Omicron variant across these regions, and the rest of the country will have the lower mortality compared to the rest ones. Here you can see the estimation of the excess deaths in the first wave, second wave, and third wave, and you can notice immediately that the second wave was far the deadliest, with over 145,000 deaths in a single wave. The third wave was the lowest in mortality and excess of deaths, with over 24,000 deaths, and you can see that you can also find difference in terms of gender and age groups, with the highest mortality recorded among men and among elder people of 60 or over years old. Here you can see the split of the country according to the waves, and you immediately will notice that Callao, Lima, Ica, Ancash, and Tumbes share the same patterns during the first wave, the second wave, and the third wave. And from there on, you can actually split. The only consistencies we found is that Arequipa, La Libertad, and Junín share the same patterns in the second wave and the third wave, and the rest of the country, most of the countries of the country have different patterns in the first and the second and the third wave. In conclusion, we found that the propagation of severe acute respiratory syndrome coronavirus 2 variants behave in Peru with varying wave patterns and regional clustering. During the COVID-19 pandemic, the working mortality rates follow with different spatiotemporal patterns with solid clustering, which might help to project the impact of future waves of COVID-19 in the country and similar countries of low and middle income. Thank you very much for your attention. My name is Antonio Quispe, and my email is aquispeg@utecedu.pe. You can follow me on Twitter as @Antonio Quispe. Thank you very much for your attention. Have a good conference.